Check out shares of healthcare provider Cano Health surging more than 30% on reports Humana and CVS are eyeing the company. Joining us from the Latitude Conference in San Diego, Contessa Brewer is with the CEO of Cano Health. NBC, by the way, is the official media partner for this event. Contessa.
Melissa, thank you very much. So you saw Cano Health shares close up 32% today on the news that Humana is making or could make a bid for the company. All right, Marlo Hernandez joins me now, the CEO. Talk to me a little bit about where you stand with Humana and where things are going.
Well, Humana is a great partner of ours. We've been working for many years, and I'm not going to comment on the rumors, but we're really excited about our momentum, about the value we're bringing to patients, and committed to that long-term value creation.
You now have 9 states where you're operating primary care centers, health care centers.
That's right.
And Puerto Rico. Talk a little bit about your model and why this is something that might be a good fit for a company like Humana.
Well, there's so much interest because value-based care is the present and the future. It's also very scarce. You know, when you are meeting patients where they want to be met, when providers win, when payers win, when you can get measurably better care at a lower cost, you need technology, you need infrastructure, you need the necessary management and processes, and that gets developed throughout the years. So you see a lot of these companies that are jumping in, from retail. You got companies coming in from the payer space, from other healthcare, because the growth and the demand is in the space and the sector.
We've seen a lot of other consolidation, mergers and acquisitions here. Amazon going to buy the parent of One Medical for $3.9 billion. That was announced this summer. CVS Health to buy Signify for $8 billion. That's a big play for home health care.
Right.
Is Humana the only company right now that is circling around you and looking at Cano Health as a potential great acquisition?
Well, there's lots of companies that are in the space, for sure. And the reason is what I just mentioned. I mean, you get these conversions between retail, consumerism. You also have got, again, where patients are being met, and that's at the primary care base. We don't have enough of it. And at Cano Health, I got to tell you, and there's not too many others that are just in the space, period, but we're the only ones who have ever shown a mortality reduction among our patients, the only ones who ever show a COVID-specific mortality. You reported on it. We talked about it last year. We're also the only one that actually have bent the cost of care and reduced the cost of care over time. And that's what happens when you've got a model that invests in primary care and prevention. But again, there's lots to work out there.
So you're saving money on the acute care, you're saying. You said you invest in primary care and you're saving on the acute care.
That's right. And it's not rocket science.
I got to ask you, because you went public in 2020. Barry Sternlicht had put some of his own money behind this, and he happens to be on your board along with Saul Trujillo, who is the big proponent and the leader of Latitude Conference, where we are now. What role have your activist investors played in pushing you to consider a sale? I mean, you've got Our Quick Asset Management and Third Point as fairly large shareholders.
Yeah, well, they have been very specific in their letters. We have active engagement, and they've praised the performance, where we stand in terms of the industry and the long-term, tailwinds. Our board.
But this is your baby, Cano Health. Do you want to sell it?
It is. Listen, we're a public company. When we stepped into the public realm, we knew that we're on sale every day by definition as a public company, and it's about that. It is about that long-term value creation. We're committed to that mission and the vision of the company.
Marlo Hernandez, thank you so much for coming on to CNBC. We appreciate it. We'll be looking for the news to break here, Melissa.
All right. Thank you very much, Contessa Brewer, with the CEO of Cano Health. Karen, you're in CVS, so I'm just wondering what you think of a potential deal here.
Well, I don't know if the FTC is going to start looking at, I imagine they're looking at Amazon. I would imagine they would look at CVS. But clearly, the landscape is changing rapidly, and there's a land grab. And, he was trying to dodge the question, but I think without really wanting to dodge the question. I read they're for sale. It's going to be a heated battle for, multiple parties. Right. Sounds like Humana maybe has the inside track because of their relationship. And maybe they'll keep him on if he's, When you have that shareholder base and they're not saying a thing at the moment, I feel like they're comfortable with what's happening.
Right. What do you think?
You know, it's interesting. The CEO, he just mentioned like technology is part of this component. And when you think about a company like CVS, I mean, they're going to have to acquire to do some of this. I just had a long conversation with a guy named Adrian Aoun, who is the CEO, founder of a company called Ford, Sidewalk Labs, Alphabet, Google, right? Like AI guy. They're using AI to kind of put software, okay, together with like a physical presence, like you know, with doctors and stuff like that. All that stuff is coming. And I think that's going to be like a next wave of innovation. That's in the private markets. Big Mark Benioff is an investor in a company like that. So to me, I just think there's a lot of really interesting stuff that's going on in health tech, and it'll be interesting to see if some of these big, large public companies are going to make a big move to kind of really, I don't know, come into the modern age and use some of this tech that is working in other industries.
You were making this point earlier too, Karen, that this is a company that went public via SPAC during the heyday, the height of the SPAC boom. And here we are, even with this huge pop, it is trading below that $10 mark, BK, and you've got to wonder about all the other SPACs that have gone public at the height of the SPAC boom that are trading below that SPAC price, and maybe this is the fate of a lot of them as well.
Well, it's extraordinary, right? That you have, I mean, it sounds to me from this interview that there are multiple parties that are interested in this company, and yet you still can't get up to the level that it went public at. That says a lot about what that SPAC bubble was like. And so I think, you know, maybe this is the one that actually makes it out. But as we know, sadly, most of them have not.
Yeah, the rest of them would kill to be where Cano is right now.
Exactly.
8. Wow.
8 and change.
8 and change. And it could go higher, yes.
By the way, in the after hours, it's up 6.7% at this point.